As patients, we trust our doctors to do the right thing and keep us healthy. But what happens when they have something different in mind? There are several people who earn the title Dr. Death, but this week we're going to talk about the one who became one of England's most prolific serial killers. This is the story of Harold Shipman, Dr. Death.
I'm Sammy.
And I'm Nicole,
and we are Spooky Sleuths.
Hey guys,
Hello.
welcome back to Spooky Sleuths.
We're so excited you came back.
And I'm going to tell you all about Harold Shipman, aka Dr. Death.
I can't wait.
Harold Shipman was born on January 14th, 1946 in Nottingham, England. Harold's parents were working class people. His dad was a lorry driver, which in the United States is a semi-truck driver.
Okay.
He didn't grow up wealthy, but he didn't live without the necessities. Harold was very smart and showed an interest in medicine at a young age. Harold graduated high school and went on to Leeds University. He was the first in his family to attend college. While in college, his mother passed away from lung cancer.
Well, that's sad.
Harold was interested in watching her receive morphine injections for her pain, but other than this strange interest, he handled her diagnosis and death really well.
That is a really strange thing to be interested in. I mean, I could see if you're a child and you're like, I'm wondering how things work, but you're an adult.
I like pulling PICC lines.
I like dealing with nasty, smelly wounds.
So, are we really that different?
No. Yes, we are that different.
Medical people are weird.
But we're different than Harold Shipman.
Also, while in college, Harold met Primrose Oxtoby, his future wife. They were both at a bus stop, and the rest is history.
I love that name, Primrose.
It just makes me want to watch the Hunger Games. They married in 1966 and would have 4 children over the next several years. In 1970, he graduated with a medical degree, which he would use to become a general practitioner in Lancashire, England.
Okay.
Harold was not without his demons. He began writing fraudulent prescription for pethidine, also known as Demerol, an opioid pain relief medication.
All right.
Harold became addicted to this opioid. When his addiction was discovered in 1975, he was forced to attend substance abuse rehab and lost his practice. Side note, it made me think I had brain surgery, and whenever I was asking for Dilaudid because I was in so much pain, I couldn't remember the name Dilaudid. So I looked at my mom and I said, Mom, can you please ask them for more? I can't remember what it's called, but heroin. And my mom's like, you literally cannot ask for heroin in a hospital. But I just became a substance abuse nurse. So that's where that was the only thing I could think of.
You can't ask for heroin in a hospital, but they do have it.
No, yeah.
They have medicinal heroin.
I don't recommend requesting it.
Or doing it ever.
He was also fined 600 pounds and was issued a warning by the General Medical Council.
Okay, so they gave him like a second chance.
Right, which is pretty great. I mean, because addiction is, we know how that is.
Yeah, and where we live, at least in West Virginia, they do that for like nurses who are battling substance abuse. They'll put you on like a probationary period. You're not allowed to handle controlled substances by yourself for a while. So it is great that they give that like second chance to these medical professionals, especially since they're so desperately needed.
Exactly. And it happens to a lot of medical professionals, more than you would think.
Not saying that they should have given Harold his license.
Yeah, let's talk about what happened when he kept his license. He was successful in the rehab, and only 2 years later, he began practicing again.
Okay.
He began working in Greater Manchester, England with a group practice. He was with this group for 15 years, but had a falling out with his partner physicians due to his violent mood swings. He decided to leave the group and developed a thriving practice in 1992. He was well respected in his community, and his patients trusted him. Other than his mood swings and opioid addiction, Harold seemed relatively normal. He had no alarming behaviors from childhood, no history of abuse as a child, and his adult life was unremarkable.
Okay, so this is kind of weird knowing that he's a serial killer.
Right, he has no prior, like what you would think, like, oh, that makes sense because
Right.
that happened in his childhood. No, he lived a pretty normal life up to this point, up until his addiction.
That's crazy.
What was unbeknownst to everyone, including his parents, he had been murdering patients from 1975 until 1998.
Oh my gosh. That's a long time.
Over 250 deaths were credited to him and his practices.
That is insane.
That is a lot of lives
250
lost.
people died and nobody noticed.
Nope.
Like, nobody thought to look at the doctor.
Right. Remember his interest in his mother receiving morphine injections? Well, experts say this is what inspired his future as a serial killer.
I mean, I guess I could see that, but I would have to challenge those experts.
Same. Prior to his addiction being discovered, Harold had a huge supply of diamorphine, or heroin in the medicinal form,
Hey, look at that.
enough to kill hundreds. It was while in active addiction that his murder started. His first victim was Eva Lyons, a 70-year-old patient. She had been suffering from terminal cancer. Harold visited her home on March 17, 1975, where he gave her an injection of diamorphine through the back of her hand. He sat with her husband while she died.
Oh my gosh.
Yeah,
So he just sits there and watches these people die.
and holds their loved one hand. And don't get it twisted, like it's not a assisted suicide situation.
No. Like, these people had cancer, they had a terminal illness, but they didn't want to die.
Right. Harold preyed on his older patients. Most were vulnerable to his false face of a healer. His youngest victim was 41-year-old Peter Lewis. While he wasn't as old as his typical victims, Harold saw the weak man suffering from stomach cancer. Now, stomach cancer is something I don't wish on anyone.
Right.
But as a physician, his job is to help his patients, not murder them because of the disease.
Right.
On New-
I've personally had patients who have had stomach cancer and they're fine one day, they get diagnosed, and they're dead in weeks. It's awful.
I swear there's a conspiracy theory with cancer. The minute people are diagnosed, it's like a downhill slide.
Yeah. Don't tell Dave that.
On New Year's Day in 1985, Harold arrived at Peter's home with his wife as his assistant. When Harold went to inject Peter with diamorphine, he had Peter's wife hold the needle for him.
Oh my gosh.
She refused and ran in the next room. When she came back, she reports seeing Harold holding Peter by the throat, strangling him. Harold claims he was trying to prevent Peter from swallowing his tongue, not strangling him.
How does choking someone prevent them from swallowing their tongue?
I don't know. At the same time, Harold was yelling, "Give up, lad. We've all had enough. We can't take anymore."
What?
But he's preventing him from swallowing his tongue.
That is not good patient care.
Not at all. Not terrible bedside manner.
Yes.
It is suggested that this behavior with this patient was due to Harold not wanting to be called out in the middle of the night for Peter anymore.
That is awful. That is your job as a doctor. Get an on-call service then.
Absolutely.
Not that hard. We don't kill people because we don't want to.
Leave in the middle of the night.
Yeah.
We knew what we signed up for whenever we owned a private practice.
Yeah.
And in that day and age.
Right.
Because Harold was credited for 250 murders, let's talk about a few of the 15 women that he was convicted of.
You don't want to go into detail about all 250 people?
It's really difficult to find to find any information about the majority of them.
Yeah.
The first is Marie West. Marie was an 81-year-old woman who Harold made a house call to. She was an elderly shop owner in Manchester. He did not know that her friend was in the next room until after he injected her with the diamorphine.
Oh.
So he's killing these people with heroin, essentially.
Yes, he's giving them an OD.
When his son asked questions about her death, first Harold told him that she died of a stroke, later changing his story to a heart attack.
Well, that's not suspicious at all.
Harold's not suspicious.
Don't be suspicious. Don't be suspicious.
So it's a little stitious.
It's a little bit suspicious. Not superstitious, but I am a little stitious.
Next is Irene Turner, a 67-year-old woman who was found deceased by her neighbor. Harold had asked Irene's neighbor to go help her pack a bag because she was going to the hospital. He instructed the neighbor to wait a few minutes before going over to her home. When she did, she found her dead in her bed.
That's not suspicious either.
Irene's autopsy showed morphine in her system at the time of death. Like, why did it take more?
Which I think is what diamorphine breaks down to, is regular morphine. Like, that's probably how it shows on the toxicology reports.
Probably. It's just, he's like others, like Jeffrey Dahmer, and like, how did they go this long without getting caught?
Right.
Next, we're going to discuss Lizzie Adams. She was a 77-year-old woman. We see a pattern, don't we? Like all older ladies.
Old women, yep.
She was a retired sewing machinist. Harold made a house call to her, stating that she had pneumonia. He even pretended to make a phone call for an ambulance to take her to the hospital before he killed her.
That's awful.
Yes.
Like, I'm sure none of them knew what was happening to them, but she really didn't know.
Yeah, she thought she was going to the hospital so he could cure her pneumonia.
My God.
His youngest victim that he was charged with was 57-year-old Maureen Ward. Maureen was a retired college lecturer. She had cancer but was doing well when she died. Harold claimed that she had died because of a brain tumor.
Oh.
Harold's final victim was Kathleen Grundy, an 81-year-old former mayoress. Harold made a house call to her when he injected her with diamorphine on her sofa under the guise of taking blood. So he like faked all these people out. Not only did Harold murder Kathleen, he also forged her will and 2 letters to make himself the heir of her estate.
What?
Harold wrote, "I give all my estate, money, and house to my doctor. My family are not in need, and I want to reward him for all the care he had given me and the people of Hyde."
What?
It doesn't make any sense to me.
Oh my gosh.
And Kathleen's estate was worth $386,000.
Okay. First of all, that's a lot of money to me, but not enough for me to kill someone and forge their will.
So many laws broken, so much evil manipulation. It's just, there's nothing good here.
All for $386,000?
Yeah, no thank you. The letter had obviously a fake signature from Kathleen, not Kathleen. So much so that some believe that was his way of subconsciously wanting to be caught.
Okay.
Others believe he thought he was just invincible.
Yeah, I mean, he had gotten away with it for
decades,
like 13 years, and he was like, well, maybe it was his subconscious being like, all right, like, I've done enough damage. Or
I'm getting old now.
Really just thought, what are they gonna do? Find out they haven't this long. They gonna take away my birthday?
Oh, and also, he also altered her medical records to make it look like she was addicted to morphine.
Oh.
To try and cover up her death.
Yeah, so when they did a toxicology report on her,
she was addicted to morphine.
Yeah.
It was the death of Kathleen Grundy that ended Harold's serial killer career.
Good.
Her family was very concerned about her sudden death, not to mention her changing her beneficiary to Harold. And he was insisting that there was no need for an autopsy.
Oh, imagine that.
When the forged will and letters were uncovered and her autopsy showed the drug in her system, Harold was arrested. Thank goodness.
Yeah.
He would be charged with the murders of 15 elderly women, a few that we have talked about.
Yeah.
Harold had all the evidence against him. The authorities exhumed the bodies of these women he was charged with murdering and found morphine in 7 of them. Some have asked, shouldn't he have been caught sooner, since he was the one creating all the death certificates?
Yes.
It's hard to pinpoint the physician as the cause of death, as they are trusted to provide accurate information to the best of their knowledge. It can be difficult, and a lot of death certificates are not accurate simply because providers don't have all the information, especially when someone has multiple comorbidities.
I could see that. Like, if you have, like, brain cancer and lung cancer, you're not gonna be able to tell which one you died from or which complication of those diseases that you died from,
Right.
unless you do an autopsy.
Absolutely. Unless it's thoroughly investigated, it's often not caused by what the provider thought it was. I think we have gotten better with this as medicine has progressed, but if we don't do an autopsy on someone, we don't know for sure.
Yeah, I mean, when COVID hit, a lot of people were saying, oh, they died from COVID. Actually, they died from respiratory failure due to complications of COVID. It's stuff like that, you know, whereas like 30 years ago, before we had all of the more advanced testing that we have now, maybe they would have just put COVID on the death certificate.
Right. If we would have every person that dies have an autopsy, it'd be absolutely unnecessary and intrusive, really.
Right. And chaotic.
And we would need so many more in that line of work.
I would do it.
If we would do this, though, Harold could have been caught sooner.
Right.
But it's a catch-22 in a kind of way. If he knew an autopsy would have been performed on all his victims, he just probably would have found a different way to murder them.
Right. There's no way to know for sure.
Some methods, such as a potassium overdose, may not be detected unless the autopsy with blood work is done immediately after death. So it may not have made a difference at all for Harold and his murders. Thankfully, for this case, though, none of the victims were cremated.
Oh my gosh, could you imagine if the victims were cremated and they couldn't get any further autopsy, like what are they called, necrotopsies or something like that?
Yeah.
And do toxicologies on them? Oh.
He
Which surprises me, by the way, because I didn't know that you were buried with blood in your body. Like, I thought they drained you and stuffed you.
stuffed you with what?
I don't know. I thought they took all your organs out and everything.
Only if you're an organ donor.
Yeah, I thought they did that for everybody.
No.
And, like, they just put stuff in you.
No.
Oh. I don't know, like fertilizer or something. I don't
What
know.
the hell, Sammy? Fertilizer? So it is common practice now for funeral homes to drain out the blood and other fluids since they facilitate faster decomp. Then they replace it with anti-decay chemicals. Having the dead body preserved in this way may serve various purposes.
So I was kind of right.
Kind of right, but I guess it would depend on if they were being embalmed or not.
Yeah.
If they weren't being embalmed, then they would have no need to drain the blood.
Okay.
So
People not embalmed.
I think it's more done now than it was maybe back then. The more you know.
Yeah.
Was there anything that could have been done to prevent this? Of course, yes. Yeah. Someone could have raised questions sooner. The average general practitioner should have less than 5 deaths annually in the patient's home, on average, of course. So his patient loss should have been questioned.
Yeah, because it's not not including like hospital deaths, things like that, like just dying in their home. Yeah.
It may have happened if his practice had regular audits of their death. Not only auditing the deaths, but I feel like the medications should have been audited as well.
Right.
Especially narcotics.
Who doesn't audit narcotics? And maybe that's a more recent thing.
It's the 90s, man.
I know, like, drugs are more prevalent now, so drug addiction is more prevalent now. So
the 90s is when we were doling out everything. You had a tummy ache, let's give you a
that's
Percocet.
true. I would have slept all the way through the 90s. I mean, I was 5 by the time 2000 hit, so I did sleep all through the 90s.
Were you even there for the 90s? It doesn't even count.
You were only 10 at the end of the 90s.
I was born in 91.
You were only 9.
I was here for all of the 90s.
4 years longer than me.
Harold Shipman was found guilty on all 15 counts of murder and 1 count of forgery in 2000. He was sentenced to live in prison, but unalived himself in 2004 in his prison cell. In 2005, a report came out about a government inquiry about how many deaths he really should have been held responsible for. The report stated that they believed he killed 250 people from 71 to 98. It is unfortunate that many murders went unquestioned by the medical community.
It is. Somebody should have questioned him. He was in a group practice.
Absolutely. It's insane. No one knows what his motive was for certain, other than he liked to watch morphine being injected.
Yeah.
That's weird. We mentioned earlier that it could have been avenging the death of his mother, but some believe he was practicing euthanasia as a way to control the elderly population.
Which is crazy.
That's weird. Others believe he was just narcissistic and believed that he had the power of life or death, killing his patients to show that power. Whatever the reason was, 250 people unjustly lost their lives.
This does bring up like questions to me about like assisted suicide and things like that, which this was not.
No, this wasn't that at all.
But it did pop into my head while listening to this that I feel like that would be a good topic for us to cover. Very controversial topic.
Yeah. Especially because I don't even know how I feel about it.
I wrote a paper about it in 8th grade.
Of course you did. Nerd.
We had to choose a topic. And I chose assisted suicide. I should have went to therapy.
Yeah. Therapy would have...
It
You
would have
still
done me
need to
great.
go to
I do.
therapy.
Everyone needs therapy.
I love therapy.
Anyway, guys.
What do you think? Do you think that he should have been caught well before that? Because I do.
Do you think I should go to therapy?
Yes, please.
Comment down below.
If you think Sammy needs to go to therapy, comment down below a black heart.
Aw, it's the color of my heart
I'm aware.
and soul. It's fine.
Okay, guys. Well, if you liked this episode, make sure you give us a rating, follow us on wherever you listen to podcasts, or head on over to YouTube, comment on the video, leave us a black heart if you made it all the way to the end. Subscribe. We do episodes every week.
Don't forget to smash that like button.
And make sure you follow us on TikTok and Instagram. Everything's at Spooky Sleuths Pod. And on that note, stay spooky, friends.